My name is Letitia Gaga, and I'm the Financial and Admin Director of Baines Avenue Clinic. And my role at Baines Avenue Clinic is to make sure that we've got stability in financials and also in the operations of the business, and the business is well run, considering our patient, which is our centerpiece, which we look after. And also my role is also to do with mainly strategic and operational issues of the organization. What excites me most about my work is to work with the people around me. I'm very really compassionate about my work. I'm also passionate. I like it so much that I work with patients, although I don't work with them directly, but indirectly I work with patients. I make sure that all what they require is provided for, in terms of medication, in terms of the labor which I give them, the people who look after them. This is what I really enjoy about, to make sure that we produce healthy patients and resulting in a healthy nation. Normally, leadership roles have been dominated by men, and as women, we are coming in on board, and we are being very powerful, and also working with the younger generation, empowering them, because you could see with our roles and where we are now, you can see that we are very few women in leadership, and we are really trying to encourage and mentor and empower the young generation to be in this leadership. This is what we are trying to do. We are coming up because of the areas where I sit. Most of the boards where I sit in one of the as a board member in Women Accounting Forum, where we do mentorship of young women and also empowering them to be in leadership position. What has shaped the institution over the years is our values of the organization. We are really committed to our values. We look at professionalism. When we are dealing with our customers, we try to be professional as much as possible. We also try to be people of integrity, and this is what we aim to achieve. We also want to make sure that our shareholders, we add value to our shareholders, and also we also interact with, also collaborate with our stakeholders, be the government, be the HPA, Health Professional Board, and also the funders. We try to work together for the common good, which is the patient, which is at our centerpiece. So the values of our organization does shape us, and also our culture of our organization. It's more to do with compassionate, because we are we look after patients. It's all more to do with friendliness, because we work with people. We work with mothers who have got children who are sick. We know how they feel, so we try to accommodate them as well. So our culture, we also try to make sure that we produce the best results when we are treating our patients. This is the culture of Baines Avenue Clinic, and also of Mazoe Pediatric Hospital. The advice which I give to women who aspire leadership in healthcare is that they need to have passion with whatever they do. Because if we talk of healthcare, you need someone who've got passion in it, not a person who's just coming for money, or a patient who's just coming for benefits. It's not your area. Because you are dealing with people who are not feeling well. We are dealing with people who are actually looking up to you to be helped. Then if you don't have that passion for your work, I think it will be really a challenge for you to work in the health sector, even in leadership. So it means you need to have passion. That's the first thing. The other thing, when you're working in the health sector, maybe I'm a mother, I don't know, you need to have empathy when you are working in the healthcare, because you are going to meet different things, you are going to meet different people who think differently. So you need to know how you handle those people, and also to be a patient of compassionate. The messages which I want to put to the young women who want to come into the healthcare sector is that they need to have a mentor, to have someone who take them and mentor them, so that they will know exactly what happens in the health sector. Because sometimes the health sector, especially if you look at medical stuff, it can be so depressing when we are working with patients who are not feeling well. So they need a mentor. Why I say they need a mentor, I've seen this in doctors. What they do, before you come to our institution and practice, you need to go for a mentorship program for 2 years, attached to a certain doctor, before you start practicing on your own. So I say, for everyone who comes into the medical field, they need to be mentored, and know if they are mentored, they are now empowered. They know what to do, and they know how to deal with patients. Because to me, the healthcare is a very sensitive area, because you are dealing with individuals. When you are dealing with someone, it's very sensitive. You need to know how to deal with that individual. Mentorship is in a number of levels. You can have a relative who is a nurse, who is in the medical field. You can have a friend or someone, just to know, to be very inquisitive about health issues, just asking, just guiding. When you go to even if you visit a medical center, you just need to ask. You just need to be very inquisitive and ask how things go, and maybe look for the person in charge, and maybe just tell you how they function and how they do their work. So you can be mentored by people who are in the medical field. And in the medical field, what I've noted, people are really willing to mentor. They are willing. I've seen it from the doctors. They actually mentor each other. Even the nursing staff, they can mentor you. Even if you go down to the nursing, the person can mentor you, and it's easy to know what is required in the health sector.